All right, today I'm actually going to be speaking about sleep apnea. Now, sleep apnea is something that everybody hears about but really doesn't know enough about, including most dentists and a lot of doctors. I've taken several of these courses and I've always learned about what it does, but it doesn't. It wasn't until this last one that I actually realized that my father died from sleep apnea. He died from esophageal cancer. And so we always thought that the cancer came from his heartburn and that he was eating spicy foods. It wasn't until I took these courses in sleep apnea that we realized when you have sleep apnea, you actually stop breathing. When you stop breathing, your stomach and your jaw tense up really bad because they want to start breathing again. When you stop breathing, that stomach starts to spasm. It's trying to get the diaphragm to get you to breathe again. When you start having that kind of episode during your sleep, that food content actually goes up into the esophagus, and over time you start getting that heartburn. We all think it's just because of our food. It's actually from the spasms of causing that food content to go up into the esophagus. Over time, year after year after year, it actually causes that ulcer to eventually get into cancer. So that pamphlet that I just passed out that sleep apnea can kill you, it actually killed my father. And it's something very dear to me, not only because of my father, but when the doctor said that we're prone to it, I thought, well, how did he get this cancer? I just thought it was from food, so I was very careful on what I was eating. Well, through time, now my daughter says, Dad, you're snoring. My wife said I didn't snore because she would fall asleep before I went to sleep. So that's why she didn't know that I was actually snoring. But my daughter says, Dad, I could hear you all the way to my bedroom. So that means it's through the walls that she could hear me. So I went ahead and got the sleep test. Now you can either go to the hospital and get the sleep test, or you can have a sleep technician go to your home, teach you how to use the apparatus that you're supposed to. You go to sleep in your own home, they come and pick it up in the morning and they'll tell you your results. Well, I have sleep apnea myself. And I have the early stage, luckily, and it is something that I will now have to be using either a CPAP machine, and a CPAP stands for continuous positive airway pressure. It's a machine that you sleep with. It's a machine just giving you oxygen, air so you can breathe, so you don't have that collapse of your throat, so you can breathe properly. Or you get a sleep appliance, which I have in the bag down there. There's a little white bag, white box, and you can pass it around. And that is an appliance that actually helps your jaw move forward and open, so when you do fall asleep, it's in a position so you can get enough air coming through. Now, most people who I've seen over time, I would see that they're breaking their teeth are getting worn down, the canines are flat, and we used to always say it's due to stress. And we've always said, due to stress, you're grinding your teeth down, so you need a night guard. Well, I started my night guard a long time ago because when I saw my own teeth, how flat they were getting, I started using a night guard just to protect my teeth. And I do that for all my patients. Until I take these sleep apnea courses, I realized that grinding that we're doing, it is an involuntary condition. You have no idea that you're doing it. But then I hear a lot of parents say, my child is grinding their teeth. And these are from 2 to 8 years old grinding. Well, what kind of stress does a kid have? They didn't get enough milk in their bottle or something like that. They're not going to have that kind of stress, but yet they're still grinding. Well, that comes from having their tonsils a little bit too large and their adenoids. So when you hear of parents saying, oh, my kid grinds so much, I could hear him grinding, they have to go to the ears, nose, and throat specialists because they're the ones that are going to help out to get the tonsils out and their adenoids. I got my tonsils out when I was only 12, and I thought just because I was getting earaches and my parents didn't know anything about that, but I got my tonsils out. People who have that problem as a child usually do not develop well mentally, so sometimes they think that they have the ADHD, and all these problems, but it's not because of that hyperactivity. It's actually because their adenoids and their tonsils are not letting them breathe properly, so they're not getting enough oxygen to the brain. One of the side effects of sleep apnea, because you are not getting enough oxygen to your brain, it affects all your organs. Now, it does affect your brain, your heart, you can get diabetes, but a lot of these clinics who are for erectile dysfunction is because they're not getting enough oxygen there either. So this actually affects men in ways that they're not realizing that it's just because they're not sleeping properly. And the sleep deprivation that we have is not only affecting our sleep, it's affecting how we perform as during the day. We get memory loss, we end up getting problems with our dexterity. There's a lot of things that go on that we don't realize. And one of the worst things, though, is our marriages. Too many marriages, they're not sleeping in the same room anymore simply because of the snoring. And then the other thing that happens is your mood changes. When you're early in life, you're married, everything is pretty nice. Towards mid-marriage, all of a sudden the personality changes, and it's because you're not getting enough oxygen to the brain, so it affects your mood tremendously. As a child, when they have that sleep deprivation, they become hyper. As an adult, we get that sleep deprivation, we get sleepy. It affects so many of the accidents that we have are due to sleep problems. People are falling asleep even at the stop sign or on the freeway. It's actually something that affects us all. So these car accidents are happening. If you get older, you start forgetting people's names. You forget the name of that song, who's singing it. It's part of that you're not sleeping well enough. One of the forms that I gave you is a form that I would love for each one of you to fill out, because this could possibly either save your life or save your life of a loved one. There's two sides to it. One of them is just a short screening, and then if you have the score that you shouldn't have, then you go to the other side. There's something called the Epworth scale. That's where we could really tell if you're not so much a candidate, but you have a possible problem that you might have the sleep apnea. And it is something that a lot of us have it, but we don't realize we have it. So you can get a sleep test at the hospital, it costs about $1,800, or you get a sleep tech going to your home, it costs $300. And it's a lot more convenient. I prefer the sleep test at home because it's just more convenient. But it is a form that you can copy, just give it out to a lot of people, because it is something that it is not aware. You hear commercials talking about sleep apnea, but it's not enough to just hear about it. You actually might have it yourself. So it is something that is a passion for me because of how close it is in my family, that I have it, and a lot of my patients, it's not just their sleep, but it also affects their teeth. It's good business for me because I get to restore their teeth, but I'd rather they restore their whole life. So after you finish on the forms, you can pass it to me. I will send it to the sleep technician, and they'll probably contact you and set up a time if you want to do a sleep test at home. And if you have any other questions, you can talk to me afterwards. Thank you very much.